Yes, ma'am.
Hello, my name is Lisa Deaton, and I'm a Louisiana Nurses Political Action Committee contributor and volunteer. As a nonpartisan organization, LANPAC is conducting interviews with candidates for our state legislature. We want to learn more about where the candidates stand on issues important to nurses and to the health and welfare of our citizens. LANPAC solicited input from nurses across our state, and our Board of Trustees finalized the questions based on the top issues that were submitted. These questions were provided to our candidates prior to their interviews. I am delighted to welcome Representative Joe Stagni, who is running for re-election to District 92 for our state legislature. Candidate Stagni, I'd like to turn it over to you now for a couple of minutes of opening remarks.
Thank you, Lisa. I appreciate it. I am running for re-election. I was first elected in District 92 in a special election in 2017. Since that time until the present, I've been on Health and Welfare Committee. I've been on the Municipal Committee. And this term, for the last 4 years, I was chairman of Homeland Security. Before that, I was a Kenner councilman from 2006 to 2014. During that time, I focused on infrastructure, ordinances that would benefit the quality of life for our residences. Was lucky enough and beneficial enough to spend more on infrastructure than the two councilmen before me and the one after me. And before that, I was a civic leader in the city. So you don't have to be elected to something to make changes and positive changes. And so during that time, I led a coalition for term limits for elected officials. I also passed an ordinance that Kenner citizens would have input on whatever projects the airport was doing in the city of Kenner, because we have an airport in a city that we don't own the airport, the city of New Orleans did. And it was our residents that were always impacted. So we felt like we should have some say in that. I'm going to jump back to when I became state rep. I focused on a lot of healthcare issues. I'm a chiropractic physician by profession. And so I have some working knowledge of healthcare and healthcare providers. And I've been a strong advocate for nurses, nurse practitioners, and really for access to care throughout Louisiana. And while I've focused on some other areas as well, I'll stick to that for now, and like to answer some of your questions if I can.
Wonderful. Okay, our first question has to do with healthcare disparities. We all know prior to COVID-19, we recognize that healthcare services are not always accessible on an equitable basis, not only in Louisiana, but across the nation. But we also realize that with COVID-19, this actually had a brighter light shined upon it. We know, though, that healthcare outcomes are only about 20% made up of our health status, and the rest has to do with social determinants of health, those non-medical factors that influence your health outcomes. What strategies do you have to assist with reducing the impact of social determinants of health on our citizens?
Well, that's a wide open, broad question. And so I think it has great impact, but it is a phenomenally complicated number of issues, because where you're born, where you live, where you learn and how you learn, and the environment that you learn in, as well as where you worship and where you work, all are determining factors in some parts of your healthcare, as well as genetics and other parts, and where we live in the country. I mean, we have a lot of industry here, and we tend to have cancer rates that are much higher than some other areas. I think in our state, several things we have to bridge gaps on. One, you can see some steps already taken with the cessation of smoking inside of casinos. That's legislation that many, many years ago, no one ever thought would pass. But that's a step in the right direction, and it has not deterred those gamblers from going in and still gambling. Our state, I give great credit to Governor John Bell Edwards. He gave access to Medicaid expansion, or he gave the ability to have coverage through Medicaid expansion. And I think we need to go a step further and make sure that everyone has access to that covered care. In our state, we probably have a 20 plus parish maternity desert where there is not a single OB/GYN in those 20 something parishes. And so we're going to have healthcare outcomes that are significantly poorer in those areas than if we just have frontline and midline providers giving good constant care, and then the more serious issues be referred to other areas. But when you're not getting just the basic care, you end up having to pay a lot more money in the long run. And so while I've been in the legislature, I've tried to vote consistently on healthcare measures that would be healthy and good. You talked about those social determinants. When I was on the council, I still advocate for this. We were a healthy city in Kenner at one time, and it was because we tried to make sure that there was a playground within walking distance of everyone's home. And so that's a number of playgrounds, but we need to keep people moving, get them out their house, get them some sunlight. So there's a whole host of things that can be done. I have to tell you that's a tough question to answer overall, because we are on the bottom of so many healthcare metrics. However, I think the single most important thing we could do, if we could increase access to care for residents in areas of our state where they don't have care, you would see a dramatic increase in some of those outcomes. I think I lost the audio, Miss Lisa.
Our next question has to
There
do
we
with
go.
faculty shortage in education. How would you advocate, or would you advocate, for federal and state funding to support recruitment and retention of nursing faculty to reduce the nursing shortage?
Well, I already advocated on some levels. I helped pass a bill that Senator McMath had that gave scholarships and money to nursing students, to other allied health provider students. So we need to incentivize not only the students, we have to incentivize teaching faculty. The nursing shortage is at a critical point in our state and really in the nation. COVID made it much, much worse. And so anything we can do to bring federal money in to subsidize teaching, not only monetarily, but tie in housing and other things that we bring teachers in, and they would be able to get something working with local government where they would get a better homestead exemption. They would get housing, and a portion of the housing be paid. So it would have to be part of the whole package. One of the things that Louisiana does do very well is that we take a small amount of money and we're able to multiply that because of the federal reimbursement. We do it better than other states, and it's because we do have some poor health metrics, but our biggest economy in the state, our biggest industry, our biggest employer is healthcare. And so it is a number of economies within themselves that healthcare flourishes. We have to make sure people have access to it, and we have to make sure that we have instructors. And I think we have to, I'm going to bridge off even further. I apologize. But even as low as high school, we should be offering classes in high school that prepares students to be part of a healthcare profession, notably nursing, because that's what we're talking about today. And they're already starting to do that in some areas. I know we've had some bridge programs from Ochsner and some other entities. We need to continue to do that if we are going to be able to deal with the healthcare problems that we're, we're facing now and what we're going to see in the future. That's all I have on that.
We're going to move into safety and violence. Gun violence, as we know, continues to roar throughout our communities, in schools, places of worship, shopping malls, outdoor gatherings, etc. What factors do you see as critical to bringing an end to this senseless act? And also, are there any strategies that you think could be employed?
Well, I think hospitals and healthcare clinics ought to be much like playgrounds and places of worship, that really firearms do not have a place there. You're not going to have doctors, you're not going to have nurses, you're not going to have other healthcare providers wanting to provide care if they feel like their safety is in jeopardy every time they're delivering that care. Senator Pat Connick had a really good bill either last year or a year before, protecting healthcare workers from violence, and I think we need to take that a step further. And a lot of the gun laws, they like to federalize those gun laws, but the people in Washington do not know the city of Kenner the way a Kenner councilman or a Kenner mayor would. And I would prefer those gun laws being made where there are restrictions on carrying firearms, made by the people who are actually involved and the ones who would suffer the impacts. Um, Sometimes those laws are made at the state level, and you may have one person representing Kenner, but you got 104 representing somebody else, not even close to here. And so it doesn't make sense to me that those types of prescriptions to trying to handling gun violence issues are not done more locally and by those people who experience those kinds of problems.
Okay. Our next is still in the safety area, and it has to do with the rapid fentanyl test strips. They can be used to determine if drugs have been cut or mixed with fentanyl. It's important information about fentanyl, and healthcare providers can take that and take steps to reduce the community risk of overdose. How would you support legislation to make rapid fentanyl test strips more readily available?
Well, one, I'd support legislation to use that every chance we can, and two, make sure that it's fully funded. I mean, right now that is the big problem. Fentanyl is uh, detrimental to healthcare providers and to those people who are taking drugs and don't even know what they're getting. And so we ought to have stiff penalties with anybody dealing with fentanyl out in the public, cutting drugs to distribute that. We've done that this last legislative session, but I think we need to go a step further and build that funding into both LDH and maybe even ways that we can help fund the private sector, because that's an important tool.
Okay. And then you mentioned in your opening remarks and within one of the other questions, access to care. Are you supportive of actions to remove arbitrary barriers that prevent all healthcare practitioners, including advanced practice registered nurses, from practicing to the full extent of their education, licensure, and training?
Yes, ma'am. I sponsored a bill one year. I helped handle a bill another year. To me, the collaborative practice agreements are an outmoded business practice that simply allows someone else to make money off the backs of advanced care nurses when they're only practicing within their scope of practice. There's so many arguments that other types of providers use, but the nurse practitioners are not doing more than they're allowed under the law. That's what they're allowed to do. They've been trained to do it. They've been educated to do it. But then they're saying, no, you can't do it because you have to pay me a percentage, even though the collaborator doesn't have to look at a patient file, doesn't have to examine the patient ever, and doesn't have to oversee the care. And I think there's a number of studies out there that show that NPs, or advanced practice nurse practitioners, do a really good job. They have great outcomes, and they actually have less malpractice claims. The Federal Trade Commission has seen it fit to say that it's an anti-competitive measure. And I want to go back to what I said earlier in the interview. We're talking about access to care for our citizens. Already, if you're a nurse practitioner, you're going to get reimbursed less than you would a family physician, or the healthcare practitioner would get reimbursed less. So we're asking nurse practitioners to go set up in areas where you're going to get reimbursed less, and then turn around and have to give a percentage of whatever you're reimbursed to a collaborator who's not even involved at that level. It doesn't make sense to me. It doesn't help the patients. And quite frankly, it doesn't help us as a state. We have to get rid of that. We have to figure out a way to do it and back down. I don't find the medical opposition to it credible. When I was on the House floor, they were talking about doing physicals um, on athletes, and I think they called it. The bill was probably called signature authority. And even though the nurse practitioner did the exam, filled out the exam sheet, they could not sign for the work they had just performed. And that's absurd. And that's a problem. We don't have enough practitioners to go around now. And you're going to try to build this hierarchy where some practitioners are making money off other practitioners. There's two people involved in healthcare. There's the patient and the healthcare provider. Anybody else that you start putting in between those two, even if it's more healthcare providers, you're adding to the cost of healthcare, and it doesn't make sense to me. And I know that's a very simplistic response, but it would be different if there were bad outcomes, if there were malpractice claims. In the VA system since 2016, you've had nurse practitioners be able to practice without a collaborative practice agreement. And there's no reason why we shouldn't be doing that right now inside of hospitals, in nursing homes. And in fact, one of the first bills I had, it wasn't full autonomy, but it was in those areas, and there was even pushback at that time. So I think that there will be a day that this is going to pass. I want to see it pass while I'm there. I want to be a part of it. I think it's the right thing to do. But other states and business models, even from businesses, are seeing, listen, we can bring in our own little healthcare clinics within our businesses, and these are big businesses I'm talking about, and they bring in nurse practitioners. And in fact, the top 10 states that are the healthiest have full practice authority to nurse practitioners. So I'm a big fan because they do great work. And look, I don't have a nurse practitioner in my family. The stuff that I know about this comes from a guy who was a state representative before me, but the research that I've been able to find supports what they've learned and been trained in. They should be able to perform with the public.
Thank you. Our last two questions are more of a general nature. The first one is, when you're reelected, what would be your legislative priorities?
Well, I'm going to have several. Crime is always number one on everybody's list. We did something last year where we gave signing bonuses. For a society to be successful, one of the things you have to have is law and order. We have some shortages in those professions as well. So we need to entice more people to be on the front lines to protect our property and our lives, and that's fire and police. Insurance, property insurance in this state, it's so out of bounds. We pay so much money, and then we're having to fight. Homeowners have to fight when claims need to be paid, and insurance companies simply pull out and say that they're not going to write anymore. The mistake that I'm worried that we'll make, or they'll try to make, is that they're going to take the right of the homeowner to make a bad faith claim against the insurer if the insurer doesn't pay in a timely manner or doesn't pay what they're supposed to pay. I think we got to protect the rights of the homeowner, but then I think we need to be very creative on how we're going to try to provide insurance. Hold on one second. Somebody's trying to call in and I'm trying to get rid of it. I should be back with you, Ms. Lisa. I'm sorry.
You are.
One of the things I think we can do to entice some, first of all, we did the fortified roofing program, put between maybe 30, 40 million in that. We did an incentive program trying to get insurance companies to pull down people off of Citizens because that's the highest price that they would pay, and then make them agree to a 5-year for coverage for 5 years. I think we're going to end up having to do more. And I think what we may have to do is look at something creative where Citizens Insurance would automatically cover the first $75,000. And state government's going to have to find ways to fund that. Then, excuse me one second. Then have the insurers pick up anything above 75,000. It would help them in their reinsurance market. It would help them to pay less claims, but it's going to be, we've tried market-driven approaches. This is more of a state-sponsored approach. I think Florida has done it. And what we may have to do, and I don't know if this is possible, we may have to go outside of state lines. We don't have enough population to drive the insurance prices down if we were to incorporate, let's say, a number of southern states. So I think that's a big issue. I'm not on the insurance committee, but I've heard from enough people that we need to get more people involved to try to lower these insurance rates. And the other one is we have the worst infant and maternal mortality rates in the country. And I say again, I don't think it's because we get bad care in the areas where you get care. It's where we get no care at all. And those are driving the rates through the roof. And so we have to get a handle on that. And that's a very complex problem, but I think it all starts with access to some kind of care early on.
Okay. And our last question is, why should the Louisiana nursing community support you as the best candidate for the legislature in your district?
Because I've supported them, and I have since day one of being elected. I know the importance of what nurses do. I know they're the largest healthcare profession in the world. And all the studies that I've read, people like the nurses more than they do the doctors. Now, I'm a doctor of chiropractic, but I'm sure they like my assistants more than they like me. Nurses are on the front line of healthcare, and we've come to depend on nurses to give us the care that we need. We need to make sure everybody has access to that care. I would ask the nursing community to look at my voting record. I don't know that I've ever voted against a nursing bill. I've carried some nursing bills, and I've gone to the floor to speak in favor of it. In the Health and Welfare Committee, I'm one of the stronger members, and I'm one of the stronger members for nursing. And I'm not afraid to tackle hard issues, especially when they're, if it's confrontational between professions. I like that we have a good coordinated system of care, but sometimes other providers do not let you practice to the level that you've been trained. And I think that's unfortunate. And at the end of the day, we need to be allowing those people who are educated and trained to practice with those patients. And so I would humbly ask for your endorsement. You guys have been supportive in the past, and I intend to win the race and come back and fight for you all again.
Okay, well, thank you so very much for taking time out of your busy schedule to do the interview with me. And what I'd like to do now is give you a minute or two to make some closing remarks.
Thank you. I've been a driving force on the Health and Welfare Committee, and I've tried to do everything I can to get access for people in parts of the state that don't have access. I've tried to fight for those practitioners who have the ability to treat under their training, to give them that opportunity. I've also been able to deliver about $200 million to the district I represent. And I've passed some important bills having to do with nurse care, nursing shortages. I totally revamped and made a new comprehensive and modernization of the nursing home evacuation plans. I've handled bills for firefighters on PTSD and cancer benefits. And we've had record investments in higher education and fully funded TOPS. And so I've taken a strong stance to be as reasonable as I can. In my view, people are more important than party and partisan politics. And so as long as I'm in Baton Rouge, I'm going to stand up and fight for my district, for the people in my district, and for the professions in the state who are trying to help people. So I humbly ask for your endorsement and support, if that's possible, to continue what I'm doing.
Okay, well, thank you for those comments. And we wish you good luck in the rest of your campaign. And again,